Welcome to Pain Specialist Australia. My name is Nick Christelis. I'm one of the co-founders of this practice. You've been in pain for a significant length of time. You're fed up, you're frustrated, you feel unheard, but most importantly, you don't have a plan of action. And the aim of this short video is to make sure that you get the most from your initial consultation and hopefully subsequent consultations at this practice. And to do that, there are a couple of things that need to be done. So I'm going to go through a few of those now. We have an amazing team that work us as the doctors to task. They try and keep us on time. They try and make sure that we give you the most from your first consultation. So firstly, thanks to our amazing team. The aim of the first consultation is for you to leave with a smile on your face, with a spring in your step, feeling enthused, inspired, and really hopeful that there is a plan that can be put into action. How do we do that? We've got more than 10 years of experience building a practice, fine-tuning the systems to make sure you get the most from this consultation. You'll be greeted at the front door by one of our staff. They will check you in, they will make sure everything is in order, and then direct you to the area to wait. Please make sure you're on time or ahead of time, because we do our best to run on time. Make sure you've got all the paperwork filled out, everything that is required, consent that we can contact your GP and all the other paperwork that we need to get through. So make sure you do all the paperwork ahead of schedule, and you will be given this before your consultation. Most importantly, make sure you fill out the questionnaire in good time and not rushed before the consultation, because that questionnaire gives us doctors, specialists, a snapshot of where you are. Now, and that forms the basis of that first consultation. You won't be rushed for the first consultation. We'll take our time. We'll go through the questionnaire, and we may focus on one or more aspects. So that'll be between you and the specialist. The aim of that first consultation is to give you a pain diagnosis or a pain diagnoses. So why you've got the pain, where the pain is coming from. That's the first aspect of the diagnosis. The second aspect of the diagnosis is what the pain is doing to you. So how it's affecting you. If it's affecting you functionally, if it's affecting you psychologically, if it's affecting you in other parts of your body, if it's affecting your ability to do things, and how it's affected you. And a lot of time people don't see how the pain has affected them. So you'll be given a pain diagnosis or diagnoses, and how that pain, importantly, is affecting you as a person. And there are a number of layers to that. So a pain diagnosis and how it's affecting you. And then the specialist will set out a treatment plan of action. It's not going to be take these medications and come back and see me when you're ready. That is not the way we work. We are proactive. We will aim to give you a full treatment plan of action. And that might include many factors, starting from very simple all the way to very complex. Simple might be lifestyle changes, modifications, adaptations, and put together a plan for that. The second step might be looking at the allied health approach and how you could best utilize an allied health team around you, getting your pain sorted. The third step might be medications, pros and cons, what's good, what's not, how to adjust, improve your medications. The fourth step might be, if those simple first three steps are not helping, an interventional strategy. So how can we use an injection to diagnose your pain? How can we use an injection to desensitize your pain? How can we use an injection to treat your pain, or injections? That's the fourth step. And then the fifth step might even be the advanced strategies to manage pain. We call this the neuromodulation strategies. We can use nerve stimulators. We can use intrathecal drug delivery. Of course, in the advanced strategies might be surgery itself. So most of you might have come from a surgeon. And in that regard, there may be an avenue for surgery that could be considered if conservative therapies are not helpful, or conservative therapies don't give you and us what we need. So on that fifth step, surgery may be an option as well. So the aim, as mentioned, is to give you a pain diagnosis, a pain diagnoses, or more than one diagnosis, how it's affecting you and your body and possibly those around you and possibly your environment as well. So the effects of the pain on you, and at least a 5-step treatment plan of action. Now, it's not to say all those steps are going to be put into place at once, but we want you to know that there are strategies, sometimes simple, sometimes complex, depending on you, depending on your context, depending on the situation you're in, to manage your pain. Bring your scan reports if you have any. Most of the time we can jump online now and look at the scans ourselves. Make sure you come with questions. Make sure you write down those questions before the consultation. So be proactive in getting the most out of this consultation. In that regard, you will get the most out of your consultation. The more you put in, the more you will get from the consultation. And we want you to get incredible value from this consultation. We want you to get answers. We want you to get a plan. We want you to get inspired. We want you to get hopeful that things can and will be done.